Do you know your LPA? Do you even know what LPA is? Christmas and New Year's has just ended, and some of us might feel a bit guilty from eating beyond our normal diet. We tend to get excited because we are surrounded by lots of food during this season. This year might have been a little bit different, but oftentimes at holidays we tend to eat differently and maybe a little more than what we would normally eat. So it's very important to be mindful after a holiday indulgence to get back to normal eating habits because those indulgences can influence your cholesterol levels. My name is Tennille Sonicson. I'm a registered dietitian, and I want to talk to you today a little bit about LPA. So there are actually two main types of cholesterol, LDL cholesterol and HDL cholesterol. HDL cholesterol is high density lipoprotein and is good cholesterol. The higher your good HDL cholesterol is, the better it is. And that one can usually be influenced mostly by physical activity. Omega-3 intake can also impact your HDL cholesterol. And then there's LDL, or low density lipoprotein, which is also known as bad cholesterol. So what is this LPA? LPA is a type of LDL cholesterol, and LPA means lipoprotein A. It's a genetically inherited type of cholesterol, and it's an independent causal risk factor for heart disease. The test for LPA measures the level of lipoprotein A in your blood. Lipoproteins are substances made of protein and fat that carry cholesterol through your bloodstream. An LPA test is not part of routine blood testing, but it really should be, and I'll tell you why. So you may actually have a high LPA level, but actually have a normal LDL level. Without a blood test to tell you that if your LPA is high, you may not realize you're high risk. About 1 in 5 people have high LPA levels and aren't aware of it, which increases the risk of atherosclerotic cardiovascular disease and stiffening of the arteries, which can put you at increased risk of heart attack and stroke. So although determined by your genetics, if you know that you have high LPA levels, which would be considered above 1.7 millimoles per liter, you can implement a strong and proactive approach of heart-healthy strategies to reduce your other modifiable risk factors. And these risk factors are part of my Healthy Heart Navigator framework and include sustainable habit change for real heart health risk reduction. If you want to learn more about modifying or reducing your modifiable risk factors for heart disease, get on my wait list today for my next free webinar. I will post the link below. I will be back talking to you soon with more information on heart healthy eating.